It sounds horrible. You may have heard of it, maybe from a grandparent, vein stripping, but put that out of your mind. There are much more advanced and much less painful procedures now. Dr. Zoe Dio is here from the Center for Vein Restoration to explain. So, Dr. Dio, thanks so much for joining us this morning. Let's just talk about that. What type of treatment do you have now that's a lot less painful, as we mentioned?
Yes, so thank you for asking, and you're right. Vein stripping is one of those procedures that people that have vein disease are familiar with because a mother, a father, a grandfather has been through it, and it is pretty scary. And now we have much less invasive procedures that we can do in our office, walk in, walk out. Several of them are simply just a skin numbing shot with a little injection of a medication. We have two that are pretty common that we use now that don't even require a lot of numbing shots. One of them is called this one right here is Venaseal. Oh, you have the Venaseal video. This is a surgical glue, and all we do is inject this glue into the vein, compress the vein, and the vein will be sealed closed. Now, this is what we do to the diseased vein. Wow. And now all of the healthy veins in the body are able to take over. And you'll see the ultrasound probe here pushing down as that glue, and a lot of people like to call it crazy glue. And it is. It's a version of crazy glue, a surgical version of it. We've been using it in open heart surgery for years, and we just now started using it in the veins in the legs. This kind of procedure, the patient will walk out. It takes about 30 to 40 minutes. They walk right out, go straight to work, and there is virtually no pain from this.
Wow, and you say they'll walk right out. So
right.
Will they instantly feel results from this, or does it take a little time?
It depends on the patient and how severe their disease is. Usually the more severe the disease, the quicker they notice the results. But the nice thing about the Venaseal is that it also will help treat the varicose vein branches coming off of the diseased vein on the inside that we have closed down. So there's some very good results, and long term, this is one of the most powerful procedures that we have.
Awesome. So let's talk about quality of life.
Yes.
How this can increase someone's quality of life, maybe just a comparing and contrast of what they'll be going through compared to after they get the treatment.
Good question. I have a patient in my office that came in on Tuesday. She had a mother with vein stripping. She did not want to get any treatment done because she saw that she has had 2 serious bleeds from varicose veins that have ended her up in the emergency room. She lives in a constant fear that that's going to happen, that she's going to wake up in a pool of blood.
Oh, wow.
And it took that second bleed to bring her into my office this past Tuesday, and she was crying while she was telling me how much she didn't want to be in my office, but that it had forced her, the symptoms had forced her there. By the time I got done telling her about what the treatments are we have today and how much milder and gentler they are, she walked out smiling. She scheduled her appointment. She has no more fear.
Nice.
So her quality of life after she has treatment, she won't be anxiety-ridden, constantly worrying she's going to bump up against a couch and have a bad bleed. Her chance of getting ulcer disease and not being able to move around well or exercise are going to go down, so she's going to have more activity, more pain-free days, and less anxiety.
So let's talk about folks helping them to get out in front of this before it becomes too severe. What are some of the things that they can take note of before it gets too painful?
Okay, so in addition to just the varicose veins, which are pretty obvious, pain signs and symptoms of heaviness, aching, fatigue, restless leg, swelling. These are common signs of venous insufficiency going on underneath, even before you see the varicose veins.
Nice. And Dr. Dio, where can people come see you?
So I have an office in Oregon, Ohio at the Mercy St. Charles Medical Building. I will also be at Ford Field in Detroit on Saturday the 21st doing free screenings at the men's health event there. So they can come down and see us there, and we'll do a free check of their legs. I have an additional office in Detroit, Southgate, Michigan, and they can see me there. And we have offices all over the country.
Well, awesome. Thanks so much for all that informative information.
Thank you.
Well, still to come on Toledo's only live local 9 a.m. show this weekend, we're making a point with art. What you need to know when your day returns.